I'm Mark Sawyer. I'm the immediate past president of our local American Academy of Pediatrics chapter. Our chapter is composed of around 500 pediatricians. We represent pediatricians from all across San Diego and Imperial County.
The leaders in our organization include our pediatrician members. They work in the San Diego County Health and Human Services Agency, Rady Children's Hospital, Scripps Healthcare, Kaiser Permanente, Sharp Healthcare, UC San Diego, Children's Physicians Medical Group, community clinics, and in private practice. Their expertise helps to develop and inform our programs. They also serve as our representatives in the community, educating our partners, funders, policymakers, and other healthcare providers on child-centered practices and services. These services and programs equip the most vulnerable families in our community with the tools to optimize their child's health and development.
In addition to working with our pediatricians, we work in the community on 3 major projects. The great part about our work is because we work with children and families, we get to work at a time where our work really, the return on investment is incredible because it's about the entire lifetime.
As a practicing pediatrician who works in a largely underserved community, there are 2 programs that the chapter supports that have an effect on my everyday practice. Reach Out and Read is a program that's a national program that kind of combines the idea of pediatricians seeing children many times over the first 5 years of life and having a lot of interactions with families, combining that with the idea that early literacy skills are so important to how children do in school and beyond in their lives. And then once children are seen for a well-child visit between 6 months and 5 years of age, they get a brand new developmentally and culturally appropriate book to take home, and the pediatrician talks to the family about the importance of early literacy and the joy of sharing books with children starting at a very young age.
The beautiful part about being an organization that provides coordination and support is we are a backbone organization that builds relationships through running great meetings and listening to our partners. For the last 8 years, we've been working on healthy developmental services. The project serves kids with mild to moderate developmental concerns.
Most pediatricians know that we should be doing routine developmental screening, but most of us don't have the time or the tools to do it properly. And what HDS has done is they've created a very easy way to do it. At our clinic, we do developmental screening within the medical home, and then if a child has a positive screen, there's a seamless referral system to get them seen for further developmental testing and for services like speech therapy or behavioral services, occupational or physical therapy, if that's what's indicated. And it's really taken what's been a challenge for pediatricians and turned it into an opportunity to work with our community partners.
Another program that we have, which is very exciting in the last couple of years, is a home visiting program. And in this home visiting program, we're with families for 2 to 3 years, helping the most disadvantaged families get the skills they need to be successful parents. This helps not only the parents, but the children. The model that we work with is the Healthy Families America model, and we've had the opportunity to work both at a national level and the local level to implement this program.
How the AAP chapter helps us is that they provide the technical support for both these programs, they provide a lot of the administrative support, and they have created the community partnerships that allow pediatricians to make these programs happen. And in my own practice, I would say on average probably about 10 patients every day walk out of my office with either an HDS referral or a brand new book from the Reach Out and Read program, or if they're really lucky, they walk out with both.